in, so just keep an eye open for those. And with that, I'll hand this over to Rebecca Morley, who's going to do the introduction section for this webinar today.
Thanks, Sarah, so much, and welcome everyone. Thanks for joining us today. Just to kick us off, I'd like to give you a little bit of the history of the Funders Forum, the Health and Housing Funders Forum, just for those who are either returning members or for those of you who are new attendees. The Health and Housing Funders Forum was founded by the Kresge Foundation and the National Center for Healthy Housing in 2009 to align philanthropic funding plans and priorities in the housing and health space. And the idea for the group originated at the 2009 National Healthy Housing Policy Summit, when several philanthropic organizations saw the value of partnering to advance investment in safe and healthy housing. The mission of the forum is to foster collaboration among philanthropic organizations to make a significant impact in the areas of healthy housing and healthy communities, and to re-envision housing so that it leads to better health for vulnerable populations. In the past, the Funders Forum has provided members with a range of opportunities, tools, resources, webinars, and peer networking. Today's session is part of a three-part webinar series, the first session being held last month and having to do with financing healthy housing strategies. Today's session is on legal strategies to facilitate healthy and safe housing in the U.S. There will be a final webinar in August. And when we send out the recording for this session, you'll get the details, the date and time of that session as well. So with that, what I'd like to do is introduce our two panelists today. We're very fortunate to be joined by Scott Burris and Katie Moran-McCabe. Scott is a professor of law and public health at Temple University, where he directs the Center for Public Health Law Research and Policy Surveillance Program. His work focuses on how law influences public health and what interventions can make laws and law enforcement practices healthier in their effects. He's a graduate of Washington University and Yale Law School. Katie Moran-McCabe is a special project manager with the Center for Public Health Law and Research. She conducts research on a variety of public health laws for the center with a primary focus on housing issues. She's been closely involved with the creation of data sets regarding nuisance, property ordinances, and other public health topics. She has a JD degree from Temple University, Beasley School of Law. So welcome to Katie and to Scott. Thank you so much for joining us today.
Thank you.
And the purpose of today's webinar really is to understand the research that you all have done and its applications for those in the field that are looking at ways to improve the quality of our housing stock nationwide. Thanks to the National Center for hosting. And with that, let me please turn over to our colleagues at the Center for Public Health Law Research.
Thank you very much. We're delighted to be here. I want to make clear that although this research has been generously funded by the Robert Wood Johnson Foundation, what you're going to hear henceforth is what we think, and doesn't necessarily represent the views of the foundation. Next slide, please. So, as the introduction suggested from Rebecca, we're not housing experts. I mean, Katie actually has some practical experience as a lawyer working in housing, but our background is in trying to understand how laws and legal practices influence public health, and how that knowledge of what works and what doesn't can guide us to more effective legal strategies. Get rid of laws that are toxic, try and spread the law. 3 years ago, we were asked by the foundation to bring that approach to bear on housing, and to start by asking, what do we know about what works and what doesn't in terms of the law? What are the actual effects of laws as opposed to the hoped for effects? And then to figure out how that kind of knowledge might be more effectively used as part of a broader strategy to promote healthy housing. In doing this work, we were drawn to, I guess what for us is a kind of habitual systems approach. We try to understand how the entire set of pieces are producing the outcomes that we see, and to think about how strategies that try and hit more than one of those pieces at once can promise at least a plausible chance of making a difference. So today we'll be talking about that systems approach, exploring a wide range of legal levers that we looked at that have some potential for influencing what we're calling health equity in housing. And finally, to say a little bit about your role from our point of view as funders in that domain. Next slide, please. The only preliminary thing I have to say is about what we mean by law when we talk about our work in public health law research. We don't just mean the laws on the books, statutes and regulations and constitutional provisions, although those are very important. And we're also interested in the laws behind public finance. So, you know, a tax is actually takes the form of a law, and the tax rules and all those, the thousands of pages of the IRS code, you know, are law, as are, for example, the rules governing the use of the low-income housing tax credit. So there's a lot of rules behind public finance. We include those as well. But we go further than that because there are both public and private organizational rules that may often play a big role in what actually happens in people's lives. There are rules, like say housing authority rules, that matter just as much as law does to the people that they apply to. And we don't distinguish between the rules of a public landlord and the rules of a private landlord, because if a private landlord says no smoking, that's like the law for the people who live in that house. And of course, there's even some level of what we would call standard operating procedures or administrative rules or guidelines for how things are done in systems, which we also include. So we have a very wide net when we talk about law. Next slide, please. So Don Berwick, a famous health system researcher and expert on healthcare, is known for his pithy statement that every system is perfectly designed to produce exactly the results that it is producing. We look at the outcomes in the world not as somehow accidents or side effects, but as the thing that the machine is making on purpose. So what does our housing system produce? What has it produced in the last half century? Well, a lot of problems with affordability. We only have 37 available affordable units for every 100 extremely low-income renter households. That's not a good picture. Almost 40 million households in the US are paying more than 30% of their incomes for housing. In fact, over 18 million households are paying more than half of their incomes for housing. So it's all measures of affordability and scarcity of quality housing for lower income people. But you know, it isn't just that our system produces people who face high rents. It produces people who don't have the money to pay the rent. You know, so our last statistic there highlights the fact that hardworking people would have to work even harder than lawyers are willing to work for hundreds of thousands a year, just at the minimum wage to have enough money to get an affordable house for the family. Next slide, please. It isn't just that there isn't enough affordable housing or that it costs too much, that people don't have enough money to pay the rent. You all know the history of racial segregation in housing in this country. And so, you know, you certainly are not surprised to know that it persists, that we still have high level of residential segregation in places across the country. But not just that, some of the classic problems that have plagued African Americans because of policies like redlining and because of mechanisms like contract for deed of sale, we have seen Black homeownership rates decline in the last 10 years to levels that are lower than we had before the Fair Housing Act. We have a lot of concentrated poverty across race. And, you know, among people living in neighborhoods of concentrated poverty, we have a lot of people who are exposed to really unhealthy conditions to this day. So the system is not, fixing itself by any means. Next slide, please. So let's turn this around. What we started with in our project was to ask, what is it we actually want the system to produce? And we gave that a name. We called that health equity in housing. And what you see in this picture are the elements of that. So at the base, clearly we want people to live in safe housing. We want the system to make safe housing that is not hazardous. We want that housing to be stable. So for whatever's going on in people's lives, they have employment, income, rent levels that allow them to stay where they want to stay for a while. And finally, that's closely related that the housing has got to be affordable. This, however, we think, looking at ultimately the health data, is not enough. In the famous Brown against Board of Education decision that the Supreme Court handed down to make school segregation unlawful, it had the ringing phrase that separate is inherently unequal. Now, in the health literature, we have instances that show that neighborhoods that are concentrated ethnically, concentrated economic, sort of everybody sort of in the same class, can be very healthy. Famous studies of what's called the Rosito effect. But overall, I think the best guess we can make is that in residential segregation, residential housing, separate is inherently unequal. We just do not get to a situation where the politics of investment and economic development and the provision of services works as well in neighborhoods that are concentrated poor or concentrated minority as it does in areas that are more mixed. And so an important part of health equity in housing is that we have much less segregation and that our neighborhoods are more diverse so that everybody has access to the kinds of amenities that the best neighborhoods have. Next slide, please. Now, in a systems perspective, the idea, the big thing you're aiming for is really important. Because it's the idea that allows, tens or hundreds or thousands of agents who are not closely coordinated to essentially synchronize and work towards the same goals. So we offer health equity in housing in that sense as a kind of motive that we can all adopt. It's also really important to measure how we're doing. One of the greatest, problems that arises when we don't evaluate law in a consistent and timely way is that solutions that turn out to fail will not be recognized as failures. There are many good things about the Fair Housing Act, but one thing you can say about the Fair Housing Act 50 years later is it hasn't really desegregated America. If its goal was truly to affirmatively further fair housing, it has not succeeded. And it's important for us to know that. There are a lot of reasons, and as Kathy O'Regan famously said, one reason we never desegregated America is we never tried. But the broad point is that if we want to improve something as complicated as what the system is producing in the way of housing, we have to be measuring a lot of different things, and we got to be seeing progress. So it's not enough that we have reduced lead if we have increased mold. It's not enough if we have safer housing altogether if it's not affordable to a large number of people who can't therefore enjoy it. And as our picture shows here, we think that we'll never have neighborhoods that are really healthy as long as we have persistent concentration by race and class. So we need the set of goals captured in health equity and housing as a measure. How are we proving this? How are we moving towards this big goal? Finally, of course, where we think we're going is going to affect what we do to get there. This is really hard. I mean, there's no question that housing is one of the most difficult policy areas we face. What we offer in this session today is just one building block. We take a serious strategic look at what law is doing at the moment and hopefully what it can do more effectively in the future. Next slide, please. Our model of legal levers for health equity and housing starts with the goal. Ultimately, I think we'll be a better, healthier country if we have more people living in good housing in economically and racially mixed neighborhoods with the amenities necessary for health. So what's the one? There's one set of, we have basically 5 sets of levers. Let's get the next button pushed on the slide, please. So one thing that law needs to help do is increase the supply of new affordable housing. And that's where you get important legal levers like the low-income housing tax credit and the various we've done a lot of looking at that, for example, the QAP and how that the rules for health equity and housing for low-income housing tax credit work. Another thing that law needs to support is the continuation or the maintenance of existing housing as affordable, stable, and safe. We know this is a real problem. Enforcement of housing codes, particularly in poorer neighborhoods, is really a problem across the country. That's why we still have 4 million households exposed to lead. But there are many other aspects to the maintenance of existing neighborhoods, including management of gentrification and vacancy and so on. So that's another big set of levers that we talk about in our work. Fighting active discrimination is certainly important. There's a lot of work to be done in that area, a lot of work to be done to improve enforcement. There's still a high level of experience in discrimination. So we need anti-discrimination law and maybe more and better anti-discrimination law and enforcement. And then finally, we have to recognize that part of the housing problem is people not making enough money. And if you have really poor people, it's hard for the market or the government to deliver adequate housing that they can manage, that we can find a way to pay for. So, we have to look at what we're doing in terms of basic economic support and choice for poor people. Finally, around all that is the set of legal levers that have to do with governance. So, this is the management of all these different levers. And it has to do with where we place authority and how authorities are linked to each other. So just for an example, we're all aware that one of our big barriers to affordable housing and desegregation is the local zoning power and the degree to which in many places the small towns and suburbs have veto power over what gets built and who gets to move in because of that. We also have massive problems of cross-sector coordination, or massive issues of cross-sector coordination, because housing has to be tied to schooling and it has to be tied to education and so on. So thinking about those levers is also important. Now, we will just be covering some of the high-level findings that we can squeeze into this webinar, but we will be releasing in the next 6 months a set of 6 reports that go into detail on all these issues. We've already released part of the work we've done on what we know in a law review article in Northeastern Law Review, which we'll be happy to share with anybody who's interested. That talks about dozens of levers and what the evidence base is for those. I think at this point, I'm turning the show over to Katie to talk about key findings.
Thanks, Scott.
That's great. And before Scott leaves us, it'd be great, just one clarifying question for you, actually 2. And then in the meantime, I think Sarah's going to tee up our first poll here for the audience. I had a question for you about contracts for deeds of sale. I'm familiar with redlining, and I've also heard of racial covenants, but what is the issue that you were alluding to with regard to contracts for deeds of sale and its impact on segregation?
Oh, I'm sorry for that little bit of legal jargon. A contract for deed of sale is essentially an installment contract for purchase of housing. So it's like rent to own. And the difference between that and a mortgage is that you don't get any equity until you make the last installment payment. Which means that if you miss payment 99 of 100, you lose everything you put in and you're evicted. You have no equity at all. This device has been, there's just a really interesting report that came out of about Chicago that suggests that African-American people lost tens of millions, or maybe it's hundreds at this point, it's been a while since I read it, but huge amounts of money collectively by virtue of being exposed to this mechanism because they couldn't get mortgages. So this was another, at the time, it was an artifact of redlining. Since Black people couldn't get mortgages, they could only buy this way, and then they were exploited and lost huge amounts of money. But now it's back. Since big business has gotten into the housing business after the 2008 crash, there's certainly reports that this is being widely used in new sales. There's almost no state law or federal law protecting consumers from these contracts. And although there's a small justification for sort of mom and pop or family sales under some circumstances under which this might be a good mechanism, overall, it's really worrisome and dangerous. And as a mass product, it's almost sure to hurt consumers. And again, historically, it's had a racially disparate use and effect, and that could well be happening again.
Great. We do have a request to share the paper that you referenced, so thank you in advance for that. In the meantime, could I ask Sarah to run the first poll, and we'll take a look at the question has to do with what types of activities are the participating funders on the call investing in: policy surveillance, litigation, policy evaluation, and lobbying. And we separated out lobbying because we know there are oftentimes funders that are very sensitive about investing in lobbying. We're curious about how many actually are able to invest in that kind of policy and law related work. And Scott, maybe just as people are responding here, what's your definition of policy surveillance? Could you give us that again, and then maybe distinguish that from policy evaluation?
Sure. Well, this is something that comes out of our work in health. Policy surveillance is the scientific and systematic observation of and tracking of laws that are important to health and welfare. So, in disease surveillance, we watch diseases because we want to know trends and conditions so we can plan action. If law is important to health, then we also, for the same reason, we want to know what the law is now in all its variation across 50 states or many communities, and we want to track how it's changing, both because we want to know and because we want to sort of promote the diffusion of legal ideas that are good. You can see an example of policy surveillance on our policy surveillance program website, lawatlas.org, including, as Katie mentioned, or as mentioned in Katie's bio, we have a city-level data set of nuisance property laws, nuisance property ordinances. We are just about to launch a 50-state eviction law data set. Katie can probably tell you more about that if you're interested too. So that's a way that we can see what the law is, but also, and in very granular terms, distinguish differences that are important from place to place. We can use that data to do evaluation research, and we can use that information to promote the diffusion of healthy public policies.
Great, thanks for that. And Sarah, how are we doing on our responses here? Is it time to close the poll?
It looks like we have about 35% of people who have responded so far.
Okay. And that could represent a little bit of, we have a mix in the audience today, a combination of funders and non-funders. So we'll give people another few seconds to go ahead and select all that apply here. And then are you able to show us the results there on the screen once it's closed?
Yes, I think so.
Okay. Well, I have to say that more people are funding lobbying than I anticipated. And it looks like an even split between policy surveillance and evaluation, and a fewer number funding litigation. Thanks for that. All right. Well, I'd like to turn over then to Katie to take us through the remainder of, or the next section of the slides.
Great, thanks so much.
Thank you, Scott.
So, okay, great. Okay, so now I want to talk a bit about the first the questions that we set out to address in this project. So the first is looking at whether these legal levers that we had identified, are they actually doing what they're intended to do? And then if they are they achieving the broader, larger goal of producing health equity in housing? And then the third question we looked at is how can we better design and use legal levers to produce health equity in housing? Next slide, please. So let's take a look at that first question. Are these legal levers doing what they purport to do? So we did not find a lot of evidence that they actually are. And mostly we just don't know how effective they are because they haven't really been evaluated. So for example, there are several landlord-tenant laws that aim to protect renters, but there's limited evidence that suggests that they're actually rarely used in lawsuits to protect tenants. And we know that there are hundreds of thousands of people evicted every year. So we're sort of, left wondering, do tenants know about these laws? And if they do they know how to use them to protect their rights? And, do these landlord-tenant laws have any impact on evictions, whether that in formal settings or informal evictions? And we just don't know. Similarly, most municipalities in the United States have local housing codes, yet there are many places where renters are exposed to housing hazards, as all of you know, lead, mold, those types of issues. So there are some potentially promising models, strategic code enforcement, landlord registration, but research is really needed to learn if these models can protect tenants without unintended consequences, such as pushing units out of the market. And can these strategies be scaled to improve housing conditions across the country? Zoning, Scott mentioned, zoning can have a really powerful effect on determining what gets built and where. And unfortunately, it's often exclusionary. So whether it's prohibiting multifamily housing or creating minimum lot sizes. So the question is, can it be used to create affordable housing? So inclusionary zoning laws are one lever that could reduce the exclusionary impact of traditional zoning. But inclusionary zoning laws vary, and we really don't know what particular features or elements are most effective. So, we're left wondering how these laws should best be written to support both more affordable units and also more diversity. And I'll just point out here on this slide, we did include a citation to the Northeastern Law Review article that Scott mentioned, but we're also happy to share that as well. Next slide, please. Okay, so we did find some evidence that a few of these levers do seem to be achieving their intended goals, at least in some ways or in certain places. So for example, Scott mentioned contracts of deeds. So these, Texas is one of the few states, there's not a ton of regulation in this area, but Texas is one of the few states that does have laws providing protections for buyers in these transactions. And there's one study of those laws in Texas that indicated that they have reduced the use of contracts for deed by investors, but there are individual homeowners, particularly in lower income communities, who are still using contracts for deed despite these laws regulating them. Then there's rent stabilization laws. So there's some research that indicates that these can have really positive impacts for some renters, renter stability, possibly reduced displacement. Although some do suggest that there are negative impacts. So for example, reducing the quantity and quality of housing. So really we need more evaluation of these laws to know if the benefits from rent control can be achieved on a large scale, and whether specific features of the laws can reduce any negative market effects. Then anti-predatory lending laws, these state laws vary in the practices that they regulate, and there's really not a lot of evidence as to their effectiveness either. But we did find some evidence that North Carolina's laws may be effective at reducing loans that have abusive characteristics while still allowing consumers to access credit. Next slide, please. Okay, so next question, if these laws are, even if some of these are achieving their discrete goals, are they tending to produce health equity in housing? And we found that for the most part, they're not. Despite the existence of the Fair Housing Act for over 50 years now, and despite state level fair housing laws and lawsuits that have challenged discriminatory practices, there are many communities in the United States that are still segregated today. The Low-Income Housing Tax Credit Program and the Housing Choice Voucher Program both make housing affordable for many people, but neither program has met the demand for affordable housing. And it doesn't seem that either program has significantly reduced the concentration of poverty or racial segregation. Next slide, please. So in addition to scanning literature for evidence on these levers, we also interviewed several housing professionals to hear from the folks that are doing this work on the ground. And these are some of the levers that interviewees pointed to as successes, although not necessarily entirely successful in all places or in all ways. So fair housing litigation, that was pointed to as having been successfully used to challenge discriminatory housing practices. There was also some other types of litigation that was highlighted. So for example, the Mount Laurel cases, and the Mount Laurel cases led to the requirement in New Jersey that all municipalities have to provide their fair share of affordable housing. Then there's the Gautreaux case out of Chicago, where a regional remedy was used to promote housing integration, and that resulted actually in the first mobility program. Local ordinances were also highlighted as a successful lever, with, in particular, Montgomery County, Maryland, was recognized by several folks as a successful model for inclusionary zoning. The Low-Income Housing Tax Credit Program, some states have included provisions in their Qualified Allocation Plan, their QAP, that encourage the siting of developments in low poverty areas. So that was recognized by some folks. And then we also heard from some people that the Housing Choice Voucher program should be fully funded so that everyone who's eligible for a voucher can receive one. And then finally, Oak Park, Illinois, was noted for its successful integration program. And while their approach was recognized by multiple informants, it was also noted that that's a very unique lever. Next slide, please. So there are some of, these are some of the aspects that prevent the levers that we just talked about from being considered complete successes. So I was saying that, those levers were identified as being successful in some ways or in some places. So why not complete successes? So these are some of the thoughts that folks had. Some people noted how lengthy the litigation process can be, and that there can also be problems with enforcement, as a result of lawsuits. So sometimes it seems that there's really no final victory. Second, in general, successful local approaches have not been scaled, so success really is limited to particular places. And then, as I already mentioned with the LIHTC and the Housing Choice Voucher programs, while they have been successful in providing affordable housing for many folks, still haven't met demand nor substantially achieved integration. Next slide, please. So these are some levers and efforts that folks that we talked to pointed to as potentially successful. So the small area fair market rent rule and regional housing choice voucher administration, both of these could allow for easier moves to more affluent neighborhoods for people with housing choice vouchers. The affirmatively furthering for housing rule, multiple interviewees generally expressed hope for this rule as a planning mechanism, but they did also, some expressed concern about HUD's commitment to really enforcing the rule. And of course, at the moment, the rule has been effectively suspended, so we'll have to wait and see what happens with that. The King County Housing Authority and the Boulder Housing Authority were highlighted as doing some innovative things around trying to foster integration and mobility, and also helping folks with housing subsidies to access various resources. And then some interviewees discussed the use of health-related funding for housing, such as using state Medicaid dollars for housing. Next slide, please. So what are some of the challenges that stand in the way of using these levers to achieve health equity in housing? So here we have some of the barriers that were identified by our informants. Exclusionary zoning, we already mentioned this briefly, but this was highlighted by several folks as a major challenge to health equity in housing. Lack of resources was another issue, and this refers both to insufficient funding to provide affordable housing, as well as insufficient resources to enforce many of these levers. Many folks highlighted racism and NIMBYism as being big issues to contend with. Then there are unintended consequences. So, for example, a concern that rent control could cause tenants to be targets for eviction, so that landlords, can get them out and raise the rent. And then localism, some folks raise the issue of local governments, responding to local politics, which can tend to be exclusionary. And so some people really identified a need for a more regional approach to really promote health equity in housing. Next slide, please. So
perhaps before we go to this next slide, I wonder if we'll run one more poll here, if that's okay, Katie?
Oh, sure.
So Sarah, you want to tee us up here? Thinking about the barriers that you just heard about from Katie, we're curious which of the barriers you've experienced, either as a funder through your grantees or directly as someone that's doing on the ground work. So here you can select again all that apply for you. And as we're waiting to hear from people on this poll, Katie, I'm just curious, there was a list of isms that show up on your list there as, barriers and challenges to the success of these laws. And my reaction is that the laws don't solve isms or are not always the answer to isms. They are maybe partial solutions. What's your experience having looked at this research, and do you have any suggestions, guidance, advice, or reflections about how to solve for isms in a complementary way to the legal strategies that you're presenting today?
Yeah, it's a good question. It's definitely a tough issue. I'm remembering one of the people that we talked to said that, it's a little bit of a double-edged sword. So while on the one hand, we are, living at a time where there is, racism is still a big issue. NIMBYism is still a big issue with people not necessarily wanting multifamily, buildings in their neighborhood and things like that. But at the same time, this is a time where a lot of people are talking about these issues. So there really is a lot of conversation about the fact that these are issues and what we need to do about them. So I think, that's cause for a bit of optimism, hopefully. And I think we just need to continue having those conversations and really, put more energy into, identifying that as a barrier and talking about, what needs to be done to overcome them.
Mm-hmm. So thank you for that. Let's see the results of this particular poll. Thanks, Sarah, for running this. I think it's interesting that both the lack of resources and lack of enforcement are higher on this poll, and I think they're related oftentimes. I think it's a frequent thing that we hear, especially in the healthy housing arena, that the lack of enforcement is related to the lack of resources for enforcement. And so maybe one thing for us to explore is, how do you adequately fund the enforcement, for example, of housing codes or other legal provisions, to ensure that they achieve their intended goals? What are the legal mechanisms, for example, for financing enforcement? So thanks for that poll, and I think we'll carry on. We have a couple more slides, and then we're going to move into discussion. And I might just ask Katie if you can be succinct in this last little section so we have some time for some questions. Thank you so much. No, sorry to rush you.
Nope, not at all. So here we just wanted to, share some thoughts that interviewees had about potential solutions. So, some folks talked about big picture, sort of fundamental reform. Several people mentioning the idea of housing as a human right, that everyone, has the right to a decent home. Some people think that more money needs to be spent on housing, or, maybe spent in different ways. So, for example, fully funding the voucher program, perhaps making changes to the mortgage interest deduction so that some of the money used for that could go towards funding the voucher program or other affordable housing programs. And then people also expressed interest in sort of strengthening current approaches like zoning. So, for example, making inclusionary zoning mandatory, or having some sort of zoning budget so that if land is sort of rezoned for less density in a particular neighborhood, then there has to be an addition somewhere else, in the community to balance out the land that now has been taken off the market for new development. So, overall, we heard about from our interviewees a lot of housing problems, really not enough ideas about how to solve them, but I think the idea of making housing a higher national priority, and shifting from viewing housing as sort of a business or an investment to recognizing it as shelter and something that everyone has the right to was really a theme of the interviews. Next slide. Okay, and I think I'll turn it back to Scott now to finish us off.
And I will try to be quick. So we are going to make a lot of specific legal recommendations, but we're still working on those right now, so stay tuned. But I think the big picture for you guys is about trying to be more systematic and experimental in how we use these legal levers. Next slide, please. We sort of think of laws from the health perspective as being like pharmaceuticals. They are treatments. And, we spend billions testing drugs before we ever use them. And then we have extensive post-marketing surveillance. And we think it's crazy that you just give somebody some new pill and never look at it, what happened again. But we'll treat 250 million people with the law and never find out whether it works. So we try and break this down, look at the legal levers. First of all, just what do they do? And then secondly, which ones seem to be most promising to do the things, that they initially need to do, and then to have a broader effect on health equity and housing. So in this model, what we're basically saying is we have some theory, we have some experience, and we make some guesses. For example, we had, Rochester, New York, a few years ago decided they were going to have a new approach to going after lead in their housing code enforcement. Okay, so it starts as a guess, you put it into practice. Let's do the next, just keep pushing those buttons because this is a funny slide. So then we, just keep pushing them until we get the whole slide, if you would. So, we evaluate how those guesses work. We track who's trying those things. And through a process of trial and error, we learn, well, actually the Rochester thing seems to work. It worked in Rochester. When I was a funder for RWJF in the Public Health Law Research Program, we funded an evaluation of that. Problem is, after that, nobody else, worked on or funded the further testing and scale up, right? So the natural process of cities learning what other cities are doing or states learning what other states are doing can often go on for years or decades before you see a good idea spread widely. And sometimes, of course, the idea is good but not great, and a little tweaking and experimentation could make it better. But we don't systematically do that with law. So part one of what we're talking about is we need to sort of figure out what are the biggest, in discrete problems for housing right now, like housing code enforcement, like location, like zoning, and try and develop a more coherent, collective, systematic approach to figuring out what are measures that can be used and scaled up. That's the first part. Of course, this, if we go to the next slide, what we see is that when you're talking about legal levers for health equity and housing in a systems approach, you're not really talking about just the Fair Housing Act. You're not just talking about just consumer lending protections or just a higher minimum wage. The problem is it's like a soundboard when you're making a recording. All those things have to be tuned so that they're synergistic and producing, the overall balance that we're looking for. In this case, the sound of true health equity and housing. This is just not going to happen on its own. It is a challenge, and although there's no simple roadmap, there is a kind of art. And it's an art of working on more than one thing at once, and it's an art of taking seriously the need to harmonize different kinds of levers across the law, and not just assuming that the law works, not just assuming that if a law does the thing it's supposed to do, it will somehow fit together with other laws and produce the overall outcomes we want. And that seems to me, when I look at the world, uniquely something that funders can do. You guys, in a sense, are like the producers. Are the investors in this sort of musical metaphor, in this levers metaphors. There is no other entity that I think is going to sort of take that big leadership position. And I think the fact that you have a consortium of funders for housing is really important. I think this relates in certain ways to the Culture of Health initiative that RWJF is doing, where they're trying to sort of put all the pieces together and understand it's more than just the parts. And I'm really happy to have had this opportunity to talk to you about how all these different laws seem to be doing.
Thank you, Scott and Katie. This has been terrific to hear about the results of this research work in such an important area. I do have a couple questions, and I'm going to the audience also to feel free to send through the chat box any questions that they have, or raise your hand in the question area in the webinar. One question that came to mind as you were speaking is the issue of categorical laws. And so, for example, in the healthy housing realm, we might have laws related to radon on the books or lead. Sometimes you'll see something around mold or moisture. What is the answer to solving for categorical laws? How do we address the fact that these things are, they show up in a fragmented way? in our legal frameworks, and then they're implemented in a fragmented way. And certainly as a person who lives in housing, you don't think of things categorically, right? You think about wanting to live in a safe and healthy home. You don't think of having to pursue that goal by going through a laundry list of various chemicals and safety items. So any thoughts or reactions to how we undo kind of the legal mess we've gotten ourselves into with these categorical approaches to healthy housing?
Well, first acknowledge the mess, right? Because what you say is perfectly logical. Like there's one family lives in one house or one apartment, and there should be one inspection that applies all, a complete set of rules for health to that. And there needs to be an agency that has the resources to have properly trained inspectors who can do this work and who can work with landlords and deal with whatever the barriers are to getting something fixed and getting the housing safe. And if that means law reform at the city level, then that we got to have enough resources and lawyers and concentration and awareness to say, well, we have to change our housing code. Clearly, we have a problem here because we've got federal-led law, we've got state-led law. It's all historically path dependent. It got passed, at different times, and then it's just kind of stuck there. All of it is fixable. In fact, getting coherent law is probably the easiest part of this picture, technically speaking, if we run into those problems of political will and focus. So we've got, as a community, to say it's a problem that we don't have a simple, basic law of healthy housing. We need that. Let's get to work on that. And then when we got that, it's a problem that we don't have enforcement agencies that are properly enforced. We got to work on that. And so on down the road.
It's fascinating that you lay out that solution because, in fact, the UK has a system very much like that. It's a national program. It's not only the national inspection program that has a comprehensive inspection protocol and trained workforce to implement those. It has funding that it puts to the repairs that are generated from those inspections. So that does exist in some countries, but obviously they're set up as a national government with a national budget and a national workforce is different than ours. And I think that's one of our challenges, obviously, is the way that housing is regulated at a very local level. And as a result of that, everything varies jurisdiction to jurisdiction. It makes it very difficult for advocates and policymakers to
on the other hand, remember, this is where strategy helps, right? Because we get a lot of benefit at the local of this in terms of policy experimentation and good ideas that come out of cities and states and get scaled. But you can only take advantage of that if you in a real way if you do it systematically. So if we could find one place that gets housing inspection right and its code right, and we test it and show that it works, then the question is, can we then will we actually focus on that and work together to scale up that model?
That's a great point. So I'm curious, in your experience, how knowledgeable are communities about these various levers that they can pull, and who have you seen as the key actors that are pulling the levers? Is it government that's leading? Is it local advocates, residents? Who's actually taking advantage of these levers, and what's the level of awareness of them?
Well, housing has been I think people we talk to who do housing work often feel like they're a kind of isolated band of people. They're not connected to the health people, not necessarily connected to the environmental people, the transportation people. And, our experience in interviews was that housing people are extremely sophisticated about the levers, extremely broad-minded, and certainly willing to experiment. But they're also isolated, under-resourced, and often feel they don't have the data they need, they don't have the connections they need. So part of this is, I think, that this yearning they have to, can we make housing more central to our thinking about what makes this a successful and healthy country? And I think it's a good sign that, that, for example, RWJF, which has traditionally been a health-focused philanthropy, has really been, the president's message this year is about housing. So I think we're seeing some of that, let's break down these silos and bring our different methods and tools and approaches together so that we can, take some of the experimentalism and data-driven quality of health work and bring it to bear in housing.
Thanks for that answer, Scott. And I think we have a question coming in through the chat, so I'm going to ask Sarah if she could just read that out for us.
Yeah, so the question that was submitted is, it would be great to know about the most promising QAP requirements or scores for LIHTC and which states are leading in this.
So what are the most promising qualified allocation plan strategies and which states are pursuing them?
All right, so RWJF has, in fact, when we were part of the Policies for Action program in doing this work, and Policies for Action also funded a couple of studies of these. One in Georgia, and I think one in possibly in Florida. I'm trying to remember. I know around the Atlanta area, that was one of the places they were working on it, and we can probably pull up some more of that information and update it if the questioner wants to write us. But Katie, do you have a clearer recollection of where some of that QAP experimentation was going?
Yep. So I know from the interviews, Texas was highlighted as having, I think their QAP was awarding points for developments that were built in high opportunity areas, and seeing more, more units than LIHTC units cited in low poverty neighborhoods. And then New Jersey also, they made some modifications. I can't remember exactly when, but somewhat recently in the last few years, basically requiring a certain percentage of tax credits to be allocated in low poverty areas. And there was a study or a report, I should say, that came out after that change was implemented, and did show an increase in the number of LIHTC developments sort of in higher opportunity areas next to public transit, that kind of thing. So I think New Jersey and Texas are two places that I would highlight.
And I think the QAP is another area where people have tended to take a categorical approach. There was a time when it was very popular to try to get lead requirements, radon requirements, asbestos requirements, et cetera, into qualified allocation plans. And then I think more recently, the state housing agencies have been less encouraging of that it was getting very complicated and it was making it tough for developers to do the kind of affordable housing work that they were trying to do. They had to meet a lot of various mandatory and optional requirements. It was just getting pretty complex. So I think, again, they're looking at the QAP. How do we take a holistic approach to those to make sure, for example, that you're covering all the elements of safe and healthy housing and affordable housing and citing, for example, of affordable housing. I think of the Enterprise Green Communities criteria as a really excellent set of criteria that covers many, many of the bases that we all care about. And there's also a separate report by Enterprise, I think it was by Enterprise, that looks at how many states have adopted the Enterprise Green Communities criteria. So when people say to me, oh, we're really interested in pursuing healthy housing and the qualified allocation plan, I oftentimes will point them to Enterprise. So final question, just in our last minute here, I'm curious, Katie and Scott, your reactions to what it is that funders for the philanthropic organizations that are on the call today, what should they be investing in as it relates to this work?
As our argument is that we need to see funders leading and helping and facilitating a more systematic and strategic approach to identifying the legal needs that are out there, figuring out what changes or enactments will plausibly address those needs, and then staying with it while we evaluate and scale up. So foundations can be models and leaders in systematic experimental development of effective solutions to these problems.
Very great. Katie, any final words?
I think Scott said that perfectly, so that's great.
Well, thank you both for joining us and for the great work that you're doing. Thanks to the foundation for supporting it. The recording from this webinar will be shared along with the article that was referenced during the presentation. And stay tuned also then for the date for the final webinar, which will be held in August on a topic that is just being finalized now. Thanks to the National Center for Healthy Housing for convening us today and for all of those who joined. Have a wonderful rest of the week. Thanks, Scott and Katie and Sarah.
Bye-bye.
Bye-bye.